a condom in her purse or in her bra and is trying to fend off this guy. And she finally is able to say, well, at least here, use this. In that role play, we got a lot of discussion, but I'm ashamed to say we didn't allow that same couple to go through the role play 21 times. If we had, we might have helped the woman more. So the way we educate is terribly important. So this is a woman after the earthquake. Where is there a clinic she could go to? A lot of them have been destroyed. She doesn't know if anything is available at the MASH hospitals that were set up. And often those were only surgeons. And if she came in without need of an amputation or setting a leg or something like that, no one was willing to see or had the time to see her for her normal pregnancy. So we have to decide who is in need of help, how, when, and where. And are we going to go and find the people that really need help, or are we just going to take the ones that show up? People talk about our population this and our population that. I often say, what are you talking about? They say our clinic population. Does that reach a third of the people, 2/3 of the people? How can we get to these people who really need help? So in Haiti, a lot of people lived in tent camps, but many others set out for the rural areas. And in general, our data showed that rural populations increased by as much as a third in rural villages. Then the rural hospitals began to feel the pinch. Supply chains were cut. Water supplies were inadequate. Women turned to indigenous healers. Here is a woman who has gone to an indigenous healer for an herbal remedy to help her through her delivery. And then, as I mentioned, we need to do resource assessments versus needs assessment. After the earthquake, in so many towns where I had the privilege of serving, people were unaware that there were community health workers, unaware that there were vaccines available, unaware that home-based health records were available. There were many resources there, and here are a couple of community health workers going out to the area where they serve to supervise the resident home visitors who are already there. If we took time to look at what are the resources in this country versus making a list of needs, we might get further faster. And in every village, there were in every community in Haiti, there are many women who are busy women, but they're willing to serve their community. The volunteers after the earthquake were incredible among Haitian people. And then we look for other extra resources, like expanded facilities, like churches and schools where immunization clinics could be held. Outdoor immunization clinics were common. One of the things we discovered in the epicenter of the earthquake area is that only 33% of the children had been vaccinated against measles. Do any of you know what happens when measles hits a refugee camp? What do you think happens? A lot of kids get measles, and then what's the next consequence? Pneumonia, eye changes because of vitamin A deficiency diseases, kwashiorkor, marasmus, and blindness. So when we discovered that only 33% of the kids had been immunized against measles, CDC sent down a whole team to begin to immunize against measles. Very, very important. So we have to think of infectious diseases. And then I was called when I was in the epicenter area. They said, Dr. Berggren, well, you'll be happy to know that CDC guys have come here with measles immunization. And I ran over to see if I could be a translator, if I could help. And I said, I'm Dr. Berggren, I speak Creole, can I help you? And they turned around and looked at me. They were all Haitian Americans from the U.S. Armed Services. They spoke perfect Creole. So access to services could be affected if the supply chain was broke down. Without CDC, we would not have had the measles vaccine. But as far as reproductive health was concerned, I met with all the health center leaders in the area. Only 5 out of 35 had condoms available at all. And then I asked, did you have any available before the earthquake? The answer was no. So the supply chain had already broken down before the earthquake. Depo-Provera, which is the #1 favorite family planning method in Haiti, quickly ran out and was no longer available. Mothers abandoned breastfeeding because they felt like if they'd been through a shock, as they called it, that their milk would dry up, or if they breastfed their babies, the milk would be, quote, spoiled, unquote. What happens when mothers abandon breastfeeding? This is one of the most important family planning methods in developing countries. And of course, we've already talked about water and sanitation and all those problems. So one of the lessons learned is that sometimes local leadership was ignored. 2 or 3 MASH hospitals had been set up in Leogane. I finally went and found the OBGYN specialist that I'd known for years. A wonderful Haitian doctor. Tears ran down his face. I have never been asked to help with the delivery, or to help set up with the delivery, or to do a C-section, he said, since the earthquake. No one had bothered to find out there's an OBGYN specialist here. But we had general surgeons that were doing all those things. Local community health workers were a resource that need not be ignored, as I mentioned. And then equipment and supplies came in that were then dismantled and taken home. It's tough to not have an x-ray machine and somebody brings one down and it's useful for a while and then they take it back home to America. There were some wonderful exceptions to that. The Canadians set up a wonderful MASH hospital in one area of Haiti on the compound where a local doctor had seen his entire hospital crumble and disappear. The Canadians went and found that doctor when they got ready to go, and they said, here are the keys. Our MASH hospital and all its equipment is your gift for having given us land to set up our hospital. And that was an appropriate response. I'm happy to give Canadians credit for that. So we need to know who the local doctors are. So here are a couple of docs coming in. Do they know who the local doctors are? Do they know if there's already an association of ophthalmologists that's active in Haiti? Or do they know there are community health workers? And then scavenging began to intensify. And boy, did we see a lot of surgical supplies distributed, so to speak, in these scavenged areas. A lot of needles. We always didn't, even if they were properly disposed of, they got somehow of these. But then hope began to arrive, and there's been a sea change in Haiti since I first went there in 1967. And that is that not only every little boy should be in school, but every little girl should be in school. And suddenly out of the tent camps, out of the rubble, we saw little girls arriving in their uniforms, maybe to sit under a mango tree with a teacher who survived, and they were back in school again. Then cholera arrived. So not only did we have tent camps, we had the cholera tents and cholera cots. And the cholera complicated the availability of maternal care, because the cholera cases took priority. If a woman was pregnant and ready to deliver, she might not think to come or even feel she had access to come, in the facilities overwhelmed by cholera. But there were good things that were happening as well. There are partners in health in Haiti, and if any of you haven't read this book, I hope you will. This is Paul Farmer, a book about Dr. Paul Farmer, Mountains Beyond Mountains. How many of you have read it? Okay. So one of Paul Farmer's rules is everyone does home visits. And he means everyone. The top surgeon, the medical director, everybody. When he goes to any of the hospitals that he's directly responsible for through Partners in Health, he does home visits. Jim Kim, who's now head of the World Bank, has also learned you do home visits. More can be learned about maternal care and maternal needs in doing a home visit than you can possibly imagine. Where are the pills kept? Are they dry? Where does the mother get water? If she delivers at home, who will bring the extra water that's needed? Many, many lessons learned by doing home visits. We are trained in America so much to work within four walls. It's so easy for us to go into our clinic, there's a nurse, there's the patient. I, as a doctor, see the patient. I don't know where she comes from. I don't know anything about her home. My job is to prescribe for her. This is called ticket medicine. I'll give you a ticket for the pharmacy, a ticket for the x-ray machine or whatever. We have to get back to understanding who our patients are, where they come from, what their needs are. Home visits are terribly important. And then we need to look for a link to the community. So here's a darling little boy who's had a crushing injury to his foot, and the nurse is wondering, who is the community health worker in his village? Nobody gave me a list of community health workers. I know his village is nearby. Who's the community health worker who can follow up on this child? The community health workers are a precious link to the community and will mean everything in the case of this child coming in to get his dressing changed or whatever he needed. Incidentally, this little kid was so proud of these new crutches that he went to the edge of a muddy field, put his crutches under his arm, and hopped across the field. I watched him. He didn't want to get the crutches dirty. But preventive medicine is terribly important. I mentioned about measles, but also tetanus of the newborn is a big problem after catastrophes. Tetanus is a problem, period. It's pervasive in the soil, and many babies are delivered on the floor, and as you know, often feces is put on the feces from cattle and other animals on the umbilical cord stump, and so tetanus of the newborn is a big killer. It doesn't need to be. If mothers get 3 shots, 3 tetanus immunizations before they deliver, transplacental antibody transport will protect the newborn for up to 6 months. And that's not difficult to do. We need to get out there and make sure at least that we're not losing mothers or babies from tetanus. Then we need to ensure safe deliveries. The nursing school didn't fall during the earthquake, so here's the dean's office. It has become the nursery, and her desk has become the delivery table. And then family planning methods, I think that's already been covered very much, but women will walk for miles. If the Depo-Provera is gone in one clinic, they'll walk for miles to another. They really appreciate and treasure family planning services. They'll stand in line for hours to get the pill. And then encouraging breastfeeding is one of the most important things we can do. If you do a birth history in Tunisia, the Congo, or Haiti, you will hear that the mother had a baby, let's say in 1963, 1965, 1967, 1969, and what are you seeing? You're hearing a 2-year birth spacing interval. Why? Because of prolonged breastfeeding. She doesn't ovulate while she's breastfeeding, or at least she ovulates much less often. So encouraging breastfeeding is very important. And here we were in Haiti with 2 things happening. The NGOs bringing in formula in bottles after we had worked for years to fight formula feeding in Haiti, because breastfeeding is so much safer and so much better for the baby. And then the mothers feeling that their breast milk was no good because of what they had been through. So encouraging breastfeeding is probably the most important form of contraception you can possibly encourage. And guess what? It's already distributed. So the supply chain isn't such a problem. And it comes in such cute containers, my husband says. Anyway. So what are the consequences of the abandonment of breastfeeding? Well, mothers begin to ovulate again, they get pregnant early again, and they know this. They're worried about this. And even grandmothers can breastfeed. I've got some good case studies about this. Suckling causes breast milk to come back. If any of you want to talk to me about this, I'm happy to do it afterwards. But practicing relactation must be taught to the providers. Most nurses and nurses training do not know how to help a mother get her breast milk back. And so we had to learn relactation devices from La Leche League and from the American Midwives Association. Women can get their breast milk back, and that's very important. Here you can see a little teeny tube going into the baby's mouth. That little teeny tube is connected to a baggie, a little plastic sack that has formula in it, just so the baby, when he sucks, will get a little bit of formula and will keep on sucking. Little by little, the mother's milk comes back, and everybody's happy. So relactation was one of the main things we had to teach in terms of reproductive health in post-earthquake Haiti. But our pharmacies ran out of supplies, and this has already been talked about, so I won't dwell on this, but where is the supply chain in the midst of all this? And then everybody was concerned about orthopedic repairs, but we had all kinds of surgeons. Did anybody offer or think to offer tubal ligation? It very often wasn't even offered, although as the trauma cases diminished, we could have offered that in many instances. So I leave you with a wonderfully nourished Haitian mother and baby, and say that we hope to see more faces like this in more areas where we have displaced persons due to catastrophes. So we've talked about most of these things, and the last thing is about community health groups and especially community health workers. And that is, to me, very important. The distribution of health workers across an area is terribly important. People say to me, oh, we talked with the village leaders and we identified health workers. I go to visit the village and I say, how many of you are from the north side of the village? All of them. What about the east and west and south sides of the village? There has been no effort to get an equitable distribution of health workers across that village area. And then health workers need to work with either mothers clubs or volunteers if they're really going to reach their people. And then beyond that, they are the capability of passing out home-based health records like these. This is a child's home-based health record and immunization record. One of the things health workers need to realize of all sorts is to ask the mother if she has a home-based hand-carried record. Saves hours of time. You can look at this record and know that the baby had diarrhea a month ago or whatever. A home-based health record for women will save the doctor or the nurse practitioner or the nurse hours, because here is the record of the last 3 pregnancies. Oh, she had 3 C-sections. Guess what? I'm going to have to count on a C-section for this mother. How do I know? I'm in a tent camp. I haven't got the hospital record, but she hasn't, if I ask for it. So community workers and home-based health records are absolutely essential. And I have a photocopy of one of the ones we used in Haiti to distribute, and then also something to give you about the care group structure. In Mozambique and in many countries in Haiti, care groups of women are replacing community health workers. They said, let us do what that guy does who comes around. We'll do it and even better, and then give us a goat at the end of the year, and we'll have a celebration. So this is a typical care group structure, but it illustrates how carefully one has to be aware of getting to every mother and every baby. So when Sean Penn became famous for setting up a tent camp in Haiti that had reached everybody and all the kids were immunized, I was not surprised to hear that there had been a door-to-door registration and every child and every mother had their own health card. And he had the best coverage of anybody in Haiti. So it works in tent camps too. And I hope you have a chance to see how much monitoring and evaluation we can get from that kind of record. From that we know how many mothers died. From that we know how many children were saved because we've cut the 1 to 4 year age-specific death rate in half, for example, because the kids are registered and followed. So on that happy note, thank you very much.
All right, so we've got a little bit of time for some Q&A. So if you wanted to raise your hands, I'll try and point out folks. Yeah.
So this could go for either one of you. You both talked about how supply chain has